Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Our guest is Dr. J. Popp, Director of Medical Affairs at Janssen Biotech, here today to talk with us about Gut Check, a brand new app just launched last month that is proving to be invaluable to folks suffering from inflammatory bowel disease. How are you doing today, Dr. Popp?
I'm doing great, Neal. Hope you are.
I'm doing well. Gut check. We've all heard the term, take a gut check to find out what your feelings are. You know, you're about to lose. It's time for a gut check, guys. But this is something totally different. We're talking about a newly developed app. Talk about this new app called Gut Check.
Well, just briefly, Neal, Janssen has been around for more than 30 years developing a variety of technologies, and we're really dedicated to providing innovative solutions in the areas particularly of immunology and oncology. And we've been a leader in inflammatory bowel disease for many years. And part of our role as being a leader in that field is to try to be responsive to our physicians and our patients to provide things for them which might help them care for their disease. And this is really how Gut Check came about. So Gut Check is an app that allows individuals to monitor their symptoms and to have really a better means of communicating with their physician. I think people have felt for a long time that they've had maybe some trouble getting information to their doctors. Doctors have been frustrated by patients who come and don't necessarily give them an accurate description of their symptoms. But this is a way where people can keep track really on a daily basis as to how they feel. That information can be uploaded to their physician, and they can be followed on a much closer basis. And also it allows intervention to occur if somebody is not doing well, and maybe it's weeks until their next appointment, and their physician can see by examining his own dashboard, as we call it, that the trend is not good, and something ought to be done in the meantime.
Okay, so communicating with your healthcare provider, you mentioned a dashboard, and those of us who are familiar with different websites that have a dashboard, an interactive dashboard where you can check your finances, check what the rate of pay is, all sorts of things. Are we talking about the patient having to email their healthcare provider, or does this app automatically send whatever information is needed pretty effortlessly and seamlessly to the healthcare provider?
It'll be very seamless. What they will input their information. There are a number of surveys that are done, Neal, on a regular basis. These are things such as what we call a GI distress scale, fatigue, ability to participate, sleep problems, what kind of symptoms they're having. So all this will be available. And what we found, Neal, over the years is that often as people start to have a flare-up of their disease, it starts slowly and kind of builds its way up. And if we could interrupt that cycle and do something, intervene with something different therapeutically, I think we can really help our patients.
When you were here before, we briefly talked about there being no cure for IBD, and you just mentioned flare-ups. So I'm going to assume that some days with IBD are worse than others, as is the case with many, many diseases. How do you treat IBD? When you have a flare-up, does this app tell you, okay, if the severity is this level, eat this or drink this or take that? If it is this level, do something different? Is that how it works? Or?
Well, not necessarily, but it would hopefully give some lead time to the physician to be able to act accordingly and appropriately. So when we talk about IBD, we're really referring to two major diseases, Crohn's disease and ulcerative colitis. And the reason it's so important to have something that can constantly and in a real-time fashion provide information to a healthcare provider is these diseases tend to be very chronic. They are characterized by periods of doing well and then not doing so well. So, as I said, a flare, somebody can be going along doing very well, and then over a couple of day period start having more symptoms. And then if those symptoms persist, that information will be readily available in a real-time fashion to the healthcare provider so that something can be considered to, again, try to break this cycle of inflammation and symptoms.
What type of support, once a patient or a healthcare provider downloads the app, what type of support should we expect to see if we find that, maybe the app isn't as user-friendly for one as it is for another?
Well, and I think that's why, and I refer to this version of Gut Check as version 101. And the people at Janssen have worked very hard putting this together, and I think they've done a terrific job. But we know that it's going to need some tweaks along the way. So what we anticipate, and already we've only introduced the app about a month ago, and we've already had 1,400 people download it. And we expect feedback. We encourage feedback. We want people to tell us what's not working, what could be better, and I'm sure you're going to see multiple versions of this, multiple iterations as we go along, Neal, making improvements along the way.
Now, what are the numbers when we're talking about folks suffering from IBD? I mean, are we talking about a few 100,000, or is this pretty common?
This is really about 1 in 200 people in this country have inflammatory bowel disease.
1 in 200.
To me, that's a big number. When we talk about degrees of separation, it's quite likely that you have a family member or a friend or somebody you work with that is affected with either ulcerative colitis or Crohn's disease.
Do either of these two diseases, left unchecked, lead to cancer of the bowel or the colon or anything like that?
Well, there actually is an increased risk of colon cancer in individuals who have inflammation of their colon, which would be ulcerative colitis, but also individuals with Crohn's disease. And they can have any part of the digestive tract involved, but if they have colonic involvement, they too are at an increased risk for cancer. So we know that the more severe the inflammation, the longer an individual has the disease, and the amount of colon that's involved, that all helps determine the likelihood or the propensity of developing cancer somewhere down the road. So that's why it's really another important point, Neal, why we keep the inflammation in check, which hopefully might reduce the incidence of colon cancer in the long run.
Could you talk a little bit about the app as far as HIPAA constraints are concerned? I mean, we're talking the app, we're talking the internet, we're talking Wi-Fi, we're talking communication back and forth between patients. We're talking maybe physicians comparing data within their practice. How does this all revolve around HIPAA restrictions?
Well, it's HIPAA compliant, to be sure, and I think that's an excellent point, and I'm glad you brought it up, Neal, because people are certainly concerned, appropriately so, about any information, any personal information. We all hear about this problem when you're on the internet, but we've done all we can to make this as compliant as, and we know it's a HIPAA compliant process, but in terms of protecting the healthcare information of our patients.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio today talking with Dr. J. Popp about Gut Check, a newly launched app for people living with IBD, or inflammatory bowel disease. It's a new app where they can track their daily symptoms, lifestyle habits via the mobile app, and share that information in real time with their healthcare professionals, who can then use that information to offer better care to their patients who are suffering from IBD. Jay Popp is the Director of Medical Affairs at Janssen Biotech, who developed this brand new app, and we're looking for big things to happen with this app. It's been great having you here with us today, Jay.
Well, thank you, Neal. Likewise, appreciate your time.
Thank you so much for returning. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.